Minister Shandro, are there any plans in Alberta to come up with a centralized booking system for pharmacy vaccinations?
Sorry, could you repeat the question? I was just in the back, so I wasn't able to hear the question.
Oh, sorry about that. I'm just wondering if there's a plan in Alberta to come up with a centralized booking system for COVID vaccinations at pharmacies.
Well, we do have, with the ministry and our relationship with the pharmacy, centralized scheduling or booking for the pharmacies to just schedule with us. I think that the Assistant Deputy Minister of Pharmaceutical, under whom the relationship with pharmacies is occurs, that he has those conversations with the pharmacies on an ongoing basis. Obviously, we will continue to make sure that our vaccine rollout is continuing to evolve and continuing to change. I don't think I can speak to whether or not that's in the works right now, but we continue to work with our pharmacies, get their feedback, as well as the feedback of Albertans and their experience in getting the vaccine either in the community from a physician or a pharmacy or in an NHS facility.
Carrie, do you have a follow-up?
Yeah, I do. With respect to Cargill, do you have any plans to try to get the mass vaccination clinic back on track prior to, sort of this next wave of Moderna shipments coming in? Is there any way to try to fast track that?
Well, and it's a good point, because the reason that it was postponed was because of the Moderna disruption. And of course, we want everyone included in 2C to continue to be a priority group. And so those folks are going to continue to be a priority. And as we have the vaccines, including Moderna, unfortunately, as you pointed out, the Moderna disruption was, I think, 65,000 doses of vaccines that didn't arrive as we were told they would. So we'll continue to keep those folks a priority in phase 2C and making sure that we get those vaccines to them as quickly as possible, including it in that one location, and working with those physicians who had been working so well. And thank you to Dr. Weiss and Dr. Coakley for the work that they've been doing to organize that clinic. Thank you.
Operator, could you please put through the next question?
Janet French, CBC.
Hi there, thanks for taking my question. This is for the minister. Dr. Teresa Tam said today that stringent restrictions adopted in some parts of Canada have slowed the spread of coronavirus, and she's urging provinces to keep restrictions in place until the summer to keep the pandemic manageable. And we've seen that provinces with tighter restrictions have slowed growth, but the trend in Alberta is still going up. R value last pegged at 1.09. So what do you plan to do to get Alberta's R value below 1?
Thanks, Janet. So we're continuing to look at the evidence, continue to work with Dr. Hinshaw in her office. She has, as you probably know, about 15 folks in her office who are helping us to understand the data in Alberta and the extent to which further tightening restrictions might be needed in the rest of our response to the pandemic. We'll continue to work with her in her office, as well as the ministry, and to make sure that Emergency Management Cabinet Committee has the best information available to them to be able to make the decisions on whether further restrictions are required and how the easing of restrictions would be taking place as our vaccine rollout continues.
Janet, do you have a follow-up?
Yeah, I guess just to riff on that, I would question what is in your next considerable line of defense as far as restrictions go, and would travel restrictions that BC is acting on today, which are enforced, would that be among your list of things to consider?
Well, we don't right now have any options that are recommended to us by Dr. Hinshaw and her office. So as we continue to look at where there is community transmission and where there is growth and where there are concerns and where further restrictions might be required, we'll continue to look at that evidence and look at that data and make sure that Emergency Management Cabinet Committee has that best available information and has those recommendations from Dr. Hinshaw.
Operator, could you put through the next caller?
Dean Bennett, Canadian Press.
Oh, good morning, Minister. My questions follow up kind of on Janet's, because I think what Albertans are looking for today is, you're seeing the numbers, it's still going up despite the restrictions. So what's the plan? What's the next step? you're saying that you're going to sort of look at the data and stuff, but where are you going with this? Where do you want to go? Are you going to focus on trying to fix it on the front end, i.e. more health restrictions? Are you going to try and hope that the vaccine kicks in and you can sort of keep the restrictions the way they are and maybe handle the extra cases in hospitals?
Well, Dean, maybe I'll go back to comments I made at the beginning of April, and maybe this even goes back to March, that we knew that this was going to be the storm before the calm. That as we went into a transition period, as the vaccine rollout continued, that we, as a province, worked incredibly hard in responding quickly to containing the variants. And that included the border pilot project, which gave us the ability to be able to test the variants for 100% of those samples, those positive samples at the border pilot project, even retroactively, so we could do everything we could to contain and mitigate the spread of the variants as we had disruptions in vaccine supply in February and March from the federal government. And it was a race between the vaccines and the variants. The variants have won. We have tightened restrictions as a consequence of that. If you're asking for specific tightening of restrictions, as I said to Janet's question, we don't have any of those recommendations right now from Dr. Henshaw, but we will continue to make sure that she has all the resources available to her to be able to make the right recommendations to Emergency Management Cabinet Committee and to me. And we'll continue to hear those recommendations from her when she comes forward with concerns that she might have about the community spread and what tightening of restrictions might be needed. But as we do see the vaccine rollout successfully being rolled out, now that we're having fewer disruptions, we're not seeing disruptions from Pfizer right now, which is good news. We've seen good uptake in the AstraZeneca vaccine, which is good news. And now we have 23% of Albertans who have had at least their first dose. We know as we have more vaccines going, then the cases will reduce. And as the cases reduce, then yes, the hospitalizations will reduce as well. But we do know that we might have concerning case growth, which we know that would be a concern for us in our hospitalizations. And so when we see that level of case growth that is concerning, or certain areas where we think that a tightening of restriction might be able to stop that type of spread, we're going to be getting that information and those recommendations to the Emergency Management Cabinet Committee at that time.
Dean, do you have a follow-up?
Yeah, is there a timeline, Minister? I mean, someone could make the argument with, almost 1,900 cases yesterday. What are you waiting for to do something? So, I mean, are you going to look at this on Monday? Are you going to make you keep saying you're going to wait for Henshaw to give you some information, but should we be more proactive here and we decide next week where we're going to go with this and how we're going to handle it?
Well, we're looking at where those cases are and where the spread is happening. And we knew that these were, by the way, I mean, these aren't the people who are identifying as positive today are people who, this is going back to the Easter long weekend. So this is a lot of times when people present as being positive, it's 2 or 3 weeks before they actually tested as positive that there was transmission. So we knew that this was going to happen. We made it very public that we were expecting, even after we tightened restrictions, that we were going for 2 or 3 weeks to be able to see continued increases in cases. So this is the evidence that we're looking and following, and making sure that that we're going to be making sure that any recommendations we would see from Dr. Henshaw would be presented to Emergency Management Cabinet Committee at that time.
Okay, we have time for one more question. Operator, could you put through the next caller, please?
Francois Joly, CBC French.
Hi, this is a question for the Minister as well. Minister, we've heard Dr. Henshaw over the last few weeks say many times that there is no specific source of spread of the virus. It's really happening all over Alberta and in various contexts. So are we already out of specific limited restriction that we can impose? Is the only thing left broader measures?
Well, broader measures, layered measures, as we saw in December, are a possibility, but that's going to depend on what the evidence shows. So we don't see that right now at this time. We do see perhaps in coming weeks, if we don't see the tightening of restrictions that occurred a couple weeks ago, if we don't see that in leveling off and bringing down the R value, as Janet correctly pointed out, then maybe tightening of restrictions might be needed, but that's going to depend on that evidence we see at that time and the recommendations that Dr. Henshaw brings forward to Emergency Management Committee.
Francois, do you have a follow-up?
Yes. So we're almost back to basically the same place we were in November and December. So what do you say to Albertans who made all those sacrificed Christmas? Was all of this pointless? We're pretty much back to where we were a couple months ago.
No, none of that was pointless, Francois. Look, I mean, let me say this, that the Albertans have made great sacrifices, as people throughout the rest of the world have as well. And we've seen, the restrictions that other jurisdictions have also had, as well as Alberta, in times that they were implemented in being able to help us reduce spread of COVID in our communities. And we know that there are going to be waves, and the waves are going to ebb and they're going to flow. And we've seen that in every other jurisdiction throughout the rest of the world. That's not to say that previous restrictions and previous sacrifices were for nothing. It's the exact opposite. They were very important measures and thank you to all the Albertans who complied with those measures in November, December, January, up until now. And continuing to make sacrifices to limit spread. Let's remember that Albertans are right now there are sacrifices being made right now, and we had further tightening of restrictions that were announced weeks ago. And thank you to all those Albertans for making those sacrifices. It is making a difference. And if they weren't making that difference, then we would see extraordinary growth in the variants right now in Alberta if we didn't have folks complying. So thank you to all those Albertans who are doing that.
Okay, thank you very much for joining us today.